demonstrated the need for more EU collaboration. 10 of these strategies are on the domain of governance. So clearly, leadership and governance were essential for an effective response. And Thierry was mentioned already some of those, so did Caroline, about what were the key strategies. Indeed, leadership, political leadership was fundamental. A timely strategy, as Caroline was saying, was key. Obviously, monitoring and surveillance and early warning systems, we had those, but we need to strengthen those. That's been said already has been key as well. The transferring of evidence from research and policy. In the publications we're going to share now, you'll see detailed analysis of the different approaches that member states took for each one of these areas. Coordination across sectors, horizontally across sectors and vertically, national and decentralized, very important. And indeed, across borders, as been said already in several occasions. Transparency gives us legitimacy and accountability, and involvement of non-government stakeholders and the population has been key. A long shopping list, very superficial perhaps, I apologize, but a lot under each one of these categories. What really tells us is that there is a case for the European Health Union. But my point today is not only the European Health Union as it's happening now, with the strength in the ECDC, very important, European Medical Agency, very important, Pharmaceutical Agency, very important, the HERA, of course. But the point I want to make today very clearly is that not only viruses cross borders, there are many other shocks that cross borders, and we need to work together. So the concept of the European Health Union has to go beyond, clearly on the pandemic treaty, clearly in the communicable diseases, clearly on what's happening, but we have to go beyond to other aspects. And we have many instruments there. Another publication we presented to the Informal Council of Slovenian Presidency was to look at the range of instruments that are there to support health systems that are available to member states to use from the Commission, to use from the European Union, to support reforms and to learn from each other. Very importantly, and there, as I mentioned, very importantly, also the exchange of evidence. Europe is very important for that. It's been said already, bringing critical mass for research and evidence, very, very important indeed. But also, not only on governance, in many other areas that we realized that they've been key for the resilience. Funding, for instance, allocating financing effectively, payment systems, allocation of resources during the crisis made a difference in the resilience of the health system. But also at the European level, there's enormous potential. Look at the joint procurement. Look at the potential of 150 million citizens purchasing together vaccines, but going beyond vaccines, going to technology. Look at the potential of health technology assessment together, learning from each other. Look at the potential of finding funds to support particular countries, support countries with more needs, and support countries to learn from each other. These are potential areas that go beyond pandemic. Health workforce has been the other key area that's been key, has been central to deal with the resilience of the health systems. It's been central to areas such as the ability to recruit quickly, change the skill mix, support the workforce. There also we have a lot of potential and need to work across Europe more effectively. Joint monitoring and forecasting of health workforce needs. There's a joint action starting. We're involved in it as well, that is trying to get member states working together on forecasting. But beyond that, I will argue today, and it's going to be controversial, we need also to coordinate our planning. If professionals cross borders, we need to coordinate our planning for the training of these professionals. A lot of potential on shared training for highly specialized healthcare. That can be certain hubs, like we do with European reference networks, could take care of highly specialized training. Developing joint standards and share best practices on training and a skill mix will be another area.
Can you conclude,
finally,
please?
I'm wrapping up here very quickly. Also in the area of delivery, we learned that this has been key for the resilience of the health systems. There, we have potential for full implementation of the cross-border directive. We have an enormous potential on redistributing patients across facilities and national borders, as we see in COVID, and indeed, lots of potential for exchanging best practices. Let's take European reference networks as a very good example now for rare diseases that could be expanded. And finally, I'm wrapping up here, digital, indeed. Digital, there's a lot of investment on digital. I think we need to continue on that. There's enormous potential that is being implemented in this case in terms of e-health developments, e-health standards, ability to cross-border our patients, sharing data for research, very, very important, and faster diagnosis, and very important, strengthening citizen empowerment. So what I'm saying today is, let's go beyond the European Health Union as we understand now for the COVID, for communicable diseases, and let's see all the potential of many areas that are beyond subsidiarity, and we should work across countries. Thank you.
Thank you, Joseph Figueras, Thierry LeFrançois, dernier intervenant pour tirer les leçons de du Covid.
And one last speaker for your group, that will be Saba Beaufred from the University of Manchester. She is paying attention to the work conditions of underrepresented communities, so that is the social aspect. And before we actually move on to Saba, I would like to bring the attention of all speakers to the importance of respecting your time code, your timeline. You have been given 4 minutes. Please, please, please respect those.
Thank you for inviting me to speak today. So I'll be quite brief. My key recommendations for the discussion and to learn from COVID is that we need to go beyond the traditional biomedical approach that we've been currently using and expand it to have a human-centered and social determinant of health approach to preparedness and response. And it's an approach that will help leave no one behind. So I'll focus on 3 key issues that the current pandemic has showed us. So first of all, we've seen that the pandemic has widened health and social inequalities, not only in Europe, but worldwide. So what it means in practice is that communities that were already vulnerable before COVID have seen their health, but also their living and working conditions worsened by the pandemic. The second point is building on what was said just before about collaborating with other sectors. So the health sector that has especially focused on infection disease control at the beginning has faced massive challenges to coordinate and to communicate with other sectors like the sector of work and employment. But there are existing capacity to collaborate and communicate. We do have a missing link that we need to address, like how do we collaborate and communicate? And the third point is focusing on employment and working conditions that are known major social determinant of health. What we've seen with COVID is that the healthcare workforce, but also other essential workers like cleaners and security guards that were working to help us go through the pandemic, have seen their labor condition worsened, especially, but not only, women, paid and unpaid carers, but also low-paid, precarious and migrant workers. For example, they were more exposed to COVID-19 while working, so they were exposed at their workplace. And for many of them, they faced a dramatic increase in their workload. And next slide, please. So I just summarized some key recommendations to be taken on board. So there is a short-term and a longer-term view. In the short term, we do have existing agendas and tools that should be strengthened and enforced. And I'm mostly referring to the International Health Regulation, the Universal Health Care, and the Sustainable Development Goal. So first of all, we should accelerate the implementation of universal health care in parallel with the global health security agenda. Let it all have shown that countries that have pushed both agendas have fared much better at responding to COVID and at addressing fairness in the response. Second, we should build on existing networks within each different sectors to establish a cross-sectoral national focal point that would be in charge of coordination and communication between the International Health Regulation national focal point that already exists and with sector representatives. That's the missing link that I was referring to just before. So this cross-sectoral national focal point should identify representatives for different sectors. And these sectors could be identified using a social determinant of health approach like Marmot's one. And the representatives for the sectors need to have dedicated positions for these historically underrepresented groups, for example, women or migrants. And finally, we need to improve employment and working conditions for all and enforce decent work standards, especially in essential and low-paid sector, and especially those who have helped us go through the pandemic. In the long term, as you know, most likely, this year we'll see the start of negotiation for a new pandemic treaty that will have to be developed. And if we are serious about having an inclusive and fair pandemic treaty, European leaders, but also global leaders, will need to engage and give a seat at the table to communities that have been historically left behind and who are underrepresented. They need to engage them in the drafting, but also the negotiation of this pandemic treaty for 3 reasons. First, this will help prevent health inequities widening during the next crisis, because we will be able to identify what challenges they've specifically faced. It will help repair and build trust in public health that was a bit affected by this current crisis, because we will be able to design appropriate and acceptable crisis response tools. And finally, as implementation science has showed us, engaging communities improve the uptake of public health intervention, and especially during crisis. So these are my recommendations. Thank you very much.
Thank you very much. Thierry Lefrançois, on l'a entendu.
So Thierry Lefrançois, we have heard several key issues that were identified. What are your recommendations, your global recommendations? Rich recommendations. Indeed. I think there are some keywords. With regards to the European vision, collaboration, governance, long-term vision, I think this is very important for the resilience of health systems. Second set, holistic framework, One Health, multi-sector. We have to make sure that the global health approach is integrated. Thirdly, solidarity. Very important at the national and international level to leave no one behind, to have a global healthcare coverage. And lastly, the financing of science and research with concrete actions to intervene quickly, transparency and training. Globally, I think those are the key words that were mentioned.